Hello, everyone. Welcome to Take It to the Max webinar, the New Year, New Glow Skin Boosting Combo. We are really excited this evening, and we have Dr. Jason Emmer, who is joining us to speak about Emmer skincare and combination treatments with Glow Pin and Afterglow, and Gio McCarthy, our owner here at PDO Max. I encourage you that anybody listening, please put any questions in the chat. Dr. Emmer would love to take them, and this is an open forum for us to chat about Emmer skincare, combo treatments, so let's get into it. Welcome, Dr. Emmer. Welcome, Gio.
Thank you, guys. Do you want me to just go? Are we good?
Yeah, go.
All right, perfect. So thank you guys for having me. I won't be too long. I'm super excited to be here today, especially with innovative, new, and progressive treatments and combinations. That's where I really come in. You know, for years, if you guys don't know me, I'm a board certified dermatologist. And when I first started, I was doing general and cosmetic dermatology, running like clinical trials. And, you know, there wasn't that many innovative things on the market that was really advancing our field. And when we started doing a lot of clinical studies and combination treatments, we really started seeing improvements in results, improvements in downtime, and we've really taken to a whole nother level over the past 5 to 10 years. And I hate to say that I've been doing this for 15 years, but at the same time, I love saying it because the results that I'm getting now are surpasses anything that I've ever done in my whole career. And that's because of things like our PDO Afterglow and PDO Max, which is why I love Gio and the team. We've really been able to come up with some amazing use of these products. And I'll talk to you a little bit about the products and how we combine them. My skincare line was designed originally for post-treatment and maintenance treatments, but now using PDO Afterglow, and you guys will learn about Glow Pin, there's so much you can do immediately and post-treatment to just get outcomes that are transcendent, more amazing than you've ever seen in patients. Even right before this, my social media manager is sending me videos of a girl that had treatment done not even 7 days ago, aggressive laser Indian skin type with almost perfect skin in one treatment with minimal downtime. So there's so much that we can do. And I want to talk to you guys specifically, mostly about the use of topical PDO. I am not the clinical scientist, so I'm not going to really go through huge clinical trials and stuff like that. I want to show you guys real information, stuff that you do every day that gives your patients results, because bottom line is, it doesn't matter about these articles anymore. What people care about are results, and they want to see improvements quickly. So what is PDO in general? PDO Afterglow, you guys, just so you know, I love it because it combines hyaluronic acid, which we need for barrier repair, deeper penetration of products, and skin plumping, especially after a laser. You guys okay? But it also includes over 1,000 smooth PDO threads. And we know that when you combine PDO threads into the skin, we're building collagen. So being able to create a combination that allows the topical absorption of PDO allows you to get a long-term improvement in collagen without a big procedure. PDOs are synthetic. They're used in many countries for years. We know that they produce collagen, and you could use them for lifting, for tightening, for all different things, depending on if they're smooth or if they have things on their surface that are used for lifting. But in general, when it breaks down, you get collagen production. So we know that if we have the topical PDO, that we'll be able to get collagen production as well through improvement in the overall texture of the skin. So research shows that there is a lot more collagen production when you add PDO to the skin. Not only does it give you improvement in tightness, but you also see a lot of quality of improvement in the skin, which I'll show you guys. And the effects can last for more than a year. In my opinion, when you're doing lifting threads, you initially see a good result, but the result really is more predominant 6 to 12 weeks later, and even up to a year, where the person looks better than they did the year before. Same thing with smooth threads, but also with the topical PDO, you're going to get enhancement in overall downtime. The downtime is going to be reduced, and you're going to see a better result, but not even initially as much as you're going to see it in the long run, which is why it's important that when you do this treatment, it's not just for the immediate after treatment, it's for the long-term maintenance of the skin through every treatment you do in the office. Whether it's a facial, you want to apply the Afterglow, whether it's doing Glow Pin at the same time, whether you're doing microneedling, RF and laser, that's what I'm going to show you. And as long as I can I'll get through as much as I can in that 45 minutes to be able to show you that. This is a great evidence of the use of threads just superficially all over the skin to get improvement in the collagen production. And you see that weeks later, her skin looks better. Now there's less wrinkles and there's more tightening. So what does a skin booster have to do with the PDO? Well, it's very difficult to get PDOs to penetrate into the skin. So you need something that's going to allow the particles to be suspended, be soluble, and get through the surface of the skin. And obviously you can channel it into the skin, but even topically, you want to be able to get that. And by adding hyaluronic acid and carboxymethylcellulose, you're able to make the PDO soluble and have the ability to pass through the skin to be able to get dermal macrophages to pick up the actual particles, get into the capillaries, get into the skin, and produce collagen. There's a lot of safety certification. You guys can talk to them about it, but I'll tell you from clinical experience, immediately after even the most difficult and most aggressive treatments that we've done, multiple past CO2, fully ablative erbium, Renuvion plasma on the surface of the skin, we have applied Afterglow with Emmer skin and have gotten enhanced outcomes. We've never seen anyone with irritation, damage to the skin, any flare-ups or any worsening of pigmentation. We've only seen improvements overall. And I want to tell you, I've been doing resurfacing for those that are new to this industry for almost 15 years. And when I first started, very aggressive laser resurfacing, even combining deep peels with CO2 lasers, which we call a zombie treatment, because you literally look like that for 3 months. But with these types of topical enhancers, I almost call them regenerative products, you are able to get significant reduction in downtime. I have patients like that Indian patient I was just describing to you, where I did a fully ablative laser combination on her, and in 5 days, she almost looks healed with minimal redness. So although there is not a lot of documented safety and efficacy, there is when it comes to suspension lifting more than there is with topical products. We're going to need more of them to actually, secure that. But listen, things I've done for years are now just getting published. So it means that clinical experience is really what matters most. And so again, I'm not going to go through these clinical studies, but the bottom line is PDO produces a biostimulatory response with a lot of collagen production and even less inflammation than the majority of products you're used to using, like PLLA. And obviously collagen, which we know topically doesn't do much, ingested does almost nothing, and injected lasted months. That's why it's not on the market. So in general, this is a one of a kind treatment. And it's one of the reasons why many of you are on this conference listening to me. And it's one of the reasons why I post about it a lot, not because I'm getting paid to do this, because my patients get better results. And with my combinations, we could do much stronger treatments to get massive improvements more quickly. In the realm of sort of spa services and sort of day-to-day maintenance, if you guys own a med spa and you're doing lighter treatments, this is something that's going to give people that glow more quickly. They want to get their headshots done. They want to get pictures taken before a wedding. They have an event coming up. These are the things you want to do in combination with a microneedling or a light laser or even a facial, just to enhance the results, which is why I actually combine this specifically with my kit, which I'll describe to you in a second. But the benefits are going to be everything that collagen does: tightening of the skin, fine lines, the dullness of the skin and radiance is going to improve because of the hyaluronic. Diminishing sunspots is going to come more from the treatments that you're doing, but it's going to allow you to see that more quickly. Healing time is going to be reduced and the skin's going to look revitalized. So this is my Dermergency kit. And when I first started years ago, I created a small kit. It was called Aerify, and in it, it had this illuminating mask. You guys could see that right here. This mask is the key player. I actually say you combine illuminating mask and PDO, and you truly have one of the best overall enhancement product protocols that you've ever seen in your practice. There's a lot of providers out there that are doing this in combination, such as Alexis Robertson in Boston, whose results are unbelievable because we're enhancing the result of these treatments. When you channel the skin, when you microneedle it, and you'll see, or you laser it, you're opening that skin up for 30 to 300 times more absorption of product. And you're talking about a product that has hyaluronic, that's in a carboxymethylcellulose carrier. It's going to allow that collagen producing threads to get into the skin. So not only are you going to get that long-term benefit, you're going to get absorption more quickly. And when the skin is burned or it's traumatized, it needs barrier repair. And so what do we do with my illuminating mask? You're infusing 8 different ingredients: lactic acid, salicylic acid, retinol, vitamin C, kojic acid, arbutin, and niacinamide. And you're getting a substantial amount of brightening and exfoliation, which is what you want if you want to see improvement in skin. But also you're getting that hydration and that long-term collagen tightening and plumping from the PDO Afterglow. And then with the kit, there's other products that go along to really speed up the healing process. So in my practice, with every laser, microneedling, facial, my patients are offered the illuminating mask with PDO Afterglow, and they do that immediately afterwards, after every treatment. Now, sometimes they'll take the mask and do it more frequently as they're healing, depending on what laser. So a stronger ablative laser will get the mask on day 3, 7, on day 0, 3, and 7. With PDO Afterglow, sometimes we have patients come in daily for a week when they're getting an ablative laser, or even send them home with it, so that they can apply it topically every single day with their healing protocols. So this is ways to enhance your overall practice, to get more improvement and get them using this product, getting them hooked on it, because they're gonna see results from it. It's designed for all skin types, including, same thing with mine, it's designed to be used with energy-based devices, following a regimen that's customized to boost your results. And honestly, you're just gonna get, hold on, I wanna lower this a second. You're just going to see much more when it comes to the improvement of the skin, because this is medical grade, much higher percentage of active ingredients. And I want to tell you, I have used, and I love a lot of the other lines that are out there, you guys, but what I have to say is very few of them give you transformational results. They may make your skin glow. You have all these influencers talking about specific ones of these products, and I'm not going to name the names, but do you see their skin changes at all? No. There's an influencer that I follow who everyone follows for skincare, but yet she still has melasma. She came to me, she wouldn't have it. So the reason is, to me, they're not using medical grade products. And that's why with PDO Afterglow, yes, it's gonna be a little more expensive for your patients, but they're gonna see results. And this is why you need to do this in your practice. And so the kit itself, which I think is perfect for med spas, lighter treatments, even some initial ablative lasers, combines a polish that helps exfoliate the skin and hydrate it, a brightening cream called High Spot that does not have hydroquinone in it, but it has many botanicals, peptides, and vitamin C, the mask, which I told you is our key player, combined with the PDO Afterglow, and a retinol that's 24-hour all-trans hyaluronic acid and licorice root, so that you don't get any inflammation. It can even be used around the eye, and including our Fusion Shield SPF, which I know a lot of you guys use, a very famous, very well-known skincare line that has 2 active ingredients called Nigerian and panthenol triacetate. Both of those are actually in my Fusion Shield. That means that people can use that treatment, that SPF, immediately after laser without any worsening in acne, irritation of the skin, and they can camouflage. And so we're gonna see, along with the PDO Afterglow, enhancement in radiance and luminosity, improvement in pores, in texture, and sunspots. And that's the thing, patients want to see outcomes. If you don't show them the outcomes right away, they want to know what they're spending their money on, or why they even came in to see you. And this is where you could see just the kit alone, and the majority of these patients have tried the kit and used the PDO Afterglow, and you just see brightening, the skin redness is decreased, their skin looks better, it's smoother, it's softer. Not a single person ever reporting irritation with the use of these products, including the patient here over here that had some acne. That's disappeared, a little bit of the rosacea, you see that's improved. And so this is our illuminating mask. And when you use this illuminating mask, it creates a shield on the skin. And this is the one thing I want to talk to you about. That shield is going to allow even more penetration into the skin. Now, we do have a sheet mask that we have patients sit under when we put the PDO Afterglow on. You could microneedle it in after the laser, you could do glow pin, you could do any of the other ways you want to channel, whether it's roller or stamper, and then we put our sheet mask on. Then we put our illuminating mask on, and you guys could see here in just a week, Asian sensitive skin type, dark circles, some mild pigmentation, and just the use of the line gives him luminosity. And that can be enhanced. You have patients here with great skin, but look at her outbreaks. This is a fitness influencer, one of my personal trainers, who is desperate for skincare that would actually help her skin. This is her using the kit. You apply the mask stays on overnight. So immediately after treatment in your office, they can go home with this on, or they can apply it and at night before they go to bed. Here's her healing process. No peeling, no irritation. It literally just transforms the skin.
I do want to interject for a minute because I really want to talk about the fact that what I love, and Dr. Emmer was one of the first people to get PDO Glow in his hands. And the reason being is because he is so aggressive with lasers, so knowledgeable. Very few people can affect melasma. Everybody talks about you can't do laser for melasma. Well, done correctly and with the right products, you can affect melasma. And there's so few of us that really, the love of lasers and the love of glowing skin really drew me to Dr. Emmer. So the minute I produced it and I got to meet him, I said, you have to try it because it goes along everything you and I both believe in. And like you said, I'm a dinosaur. I've been doing laser for 30 years and true dinosaur. Like before laser was the hot thing, before plastic surgeons talked about great skin, they would lift crappy skin. So, and we talked about that, and it just always amazed me. So watching these videos and seeing the glow, the true glow on these people, just, it warms my heart because that is why I produced PDO Glow. But I'll let him.
That's why I produced my skincare line. And that's why I think we connected so well, because the ingredients in the skincare are just the perfect complement to this treatment. And the one thing I'll tell you is you'd be surprised when people say, well, that's an add-on, it's going to be more expensive. If a patient comes in for treatment and I tell them they have to do this, they're not going to want to. Well, I have one of the largest practices here and in New York, and that's not the case. Patients want to be told what to do. They want to spend more on better results. They get upset when they do a treatment and nothing happens. And that's the problem. The patients that I'm seeing have tried everything. But when I dig into it, they've tried things and not been given the right regimens. They haven't been given right aftercare. They haven't been given the immediate treatment they need. Like if you do a laser, combining it with the afterglow so their downtime is less, or so they heal faster, or they get much more of an outcome more quickly. And that's the thing, is once you do that and they see the changes, the patients will continue to do treatment. And one of the things we did at the beginning with PDO Afterglow, because I was really a true believer in it, was using it almost every day for patients that did bigger lasers, whether it was a stronger Fraxel or a stronger halo and they wanted more downtime more quickly, or CO2 combination with microneedling radiofrequency. We literally had them do it every day. We would draw it out in syringes and give it to them to take home and drop on their skin, and their outcomes are 100 times better, like literally. And then long term, you see the effects of the collagen production. And when patients see the fine lines, the plumping, all of that improve, they want to do that treatment all the time. And this is just use of skincare. And this is the thing, you guys, skincare with even just a PDO and a roller or a stamper or a glow pin. And this is the type of results you want to see. And I did this, I actually presented this on Access Hollywood. And you guys can see, I'm not going to go through that whole video, but I want you to see that with a stronger laser treatment in just a week, 7 years and 7 days with what the segment was. And I didn't make up that segment. It was what happened from the treatment, was combining treatments you guys were all doing. This is BBL Moxie combined with our skincare line and PDO. And we just see, the patients do these treatments and you see the brightening, you see the improvement. I mean, this patient should be red for much longer. She shouldn't see as much of a result in a single treatment, but with the right protocols, you do get that. And then what do you see on the bottom right here? Her so happy about this outcome that she wants to come back for more. And so all these things need to be playing a role when you're thinking about the skin, exfoliating, brightening, cleansing. And that's what I did with our skincare line. We have SKUs that are being developed over the next few years that will continue to come out within these icons so that you see more and more of products that are going to be utilized along with immediate treatments like a PDO Afterglow or an in-office treatment to enhance their outcome. And that's where you're going to really see the benefit. It's combining the skincare with the office treatments. So we're taking Emmer Skin, we're combining it with Afterglow, however you want to use it, whether it's laser, glow pin, microneedling RF. I mean, I know what everybody does nowadays. Even after peels, patients need to be putting this on their skin. It's going to accelerate healing. You're going to get more hydration. You're going to get long-term and immediate from the PDO and the HA. You're going to get decreased redness, and you're going to see textural change improvement. And that's what patients want. They want that glow. They want to see improvement. Obviously, I have to have my partner try it, make sure, you know, that everyone can see that it's not just me making this up. People I know are utilizing it. Sensitive skin types, like Asian skin with melasma. Look at this, using our combination of, I believe she did microneedling RF, PDO, Emmer Skin, and look at the results. Like, here's the typical Asian client, mid-30s to 40s, crepey skin, a little bit of pigmentation. You could see, although she stays out of the sun, Asian clients get pigmentation. It develops over time. And so combining your treatments in the office, like your microneedling RF, laser, you can do that safely with the right skincare protocols. So here's our Moxie. We add in our PDO, we add in the mask, and then now we apply the illuminating mask. So I'm going to show you guys here again. We apply the mask, and again, that shield is created. So if PDO Afterglow is on the skin right now, it's going to penetrate 300 times more. That's what the topical studies show. And actually, Vic Narkar and I did it. This is a week later. Take a look at her skin a week later. Look at the glow. I mean, now she should be rolling and stamping weekly with skincare, coming in and doing PDO with microneedling once or twice a month, and then every 4 to 6 weeks we do a laser and we combine. And like, this is one treatment, okay, for somebody in their 40s. And this is not an aggressive treatment either. This is microneedling RF combined with Moxie. Moxie, for you guys, just so you know, if you don't have it, is 1927. And 1927, although people think it's a lot, it's not. It's very superficial. If you understand lasers, the depth of penetration of a 1927 is very minimal. That's why you don't see skin tightening. But I want you guys to look at her mouth. Look right here. This is key. Look at the wrinkles here. That combination of the PDO Afterglow being on there, enhancing the results, plus microneedling RF is what gets you the tightening. What gets you the pigment and color improvement is my skincare and the laser. And that's why we call it Tighten Bright. You need to combine treatments to get tightening and brightening. Same thing here. This is my partner doing the same thing. We're testing it out, wanting you to see, again, microneedling RF, laser, applying the mask, and then again, the PDO Afterglow and mask would be applied right now, which is what's happening here, plus my serums and the mask, and then we apply the illuminating mask. I'm not going to go through all the skincare products, but take a look a week later. Glowing skin. This stuff is not filtered. I don't show filtered or selfies ever. I only show selfies. I don't show anything like that. So immediately after, it can be very swollen. And the GO, this is the one thing I think is really going to be the sort of game changer for the product, is getting it on immediately decreases the swelling. So if you take a look at him right now, he's very swollen, right? We did deep microneedling RF. You do superficial laser. You might also add, you know, something else at the same time or whatever, BBL for light. You're adding a lot of energy, and you know laser technologies, that builds up jewels in the skin. So they're gonna get very swollen. In old days, we used Crisco, we used petrolatum, okay? Anyone that's having any company, which there are companies that still do this, like Elta, for example, their post-care is petrolatum. Like, it is the most ridiculous thing I've ever heard of, because that's gonna keep the heat in. We want the heat to come out. And how do we want the heat to come out? We want to open the channels. We want to improve that barrier that's been damaged. That's PDO Afterglow. That's the HA. And then the HA brings in those particles that now produce more collagen, and you see regeneration of tissue much more quickly. So a couple of days later.
So this is day 2 after my.
It's only 2 days after what I want you guys to know. If you know 1927, this should be day 7, 6 to 8, what he looks like right now. At a 20% density of the skin, the elevation of heat is prolonged in a 1927, but because we did the post-procedure kit plus PDO, you see the improvement. So look a week later, almost like nothing's been done. So like today, I did this exact treatment on a celebrity. The only thing I added different was glacial. And that's another whole conversation we can have later.
Great conversation to have.
Another conversation. But that allowed us to get her to be able to do headshots tomorrow. And it's crazy what you can do. So these are some of their own internal results that you guys could see: improvement in pigmentation, fine wrinkles, even after a single treatment of just microneedling with products. So it just shows in general that these products work. Topical products can create improvement. And remember I talked about that Access Hollywood video that I didn't show the whole thing. What we did was in 2 phases. The first phase was skincare for 2 weeks. We did a Vizia. Her age went down 2 years. You look at this patient right here, microneedling with PDO. Her age looks like at least 5 years improved, right? Now you go to phase 2, add laser, add Emmer skin, add more PDO, and we're talking 7 years and 7 days. That's really what you can do. And without surgery, that's pretty phenomenal. Darker skin tones can be treated. And look at, here's the thing. This isn't really true melasma. This is what we call ashy dermatosis. This is where darker skin patients from sun, from rubbing, from hormones, from oral contraceptives, whatever it is, get this ashy look where their complexion is not even. But if you look in the after photo, in just a few weeks of doing microneedling, it's already improved. If we added my skincare, even more than that. Same thing here. This is a deep, deep wrinkles. There is no way the texture of this skin is going to be improved significantly without lasers. But look at the severe sun damage improvement. You could see, you know, a big change in the glow of the skin. There's less pigmentation, less fine wrinkles, and there's some tightening. Look even here, from here to here, there's a little bit of tightening. So can you add an Elicor? Can you add aggressive laser and a facelift? Yeah, and actually post facelift PDO is great. We use it for that too. So here's a great example of combination treatments that I'm going to show you guys. We need that collagen to be on hyperactive drive to build collagen and tighten the skin, but we also need the surface to exfoliate. And that's the thing. If you truly want impressive treatments, it's that glow that Gio was talking about. It's that evenness, pore reduction, smoothness, the smile that people get when they look at their skin and it's radiant. This patient was depressed for years. No one would treat her. Indian skin type. I'm like, you need to do laser. Oh, I can't do laser. I'm like, well, you didn't go to the right person. So we, again, pre-treatment with the skincare kit and a couple other products. In this case, treatment was Halo, PDO Afterglow in my skincare, and then Emmer skin. Here's Serge. Oh wait, hold on. I'm gonna show you guys really quickly. So here's the video of her treatment, just so you guys know it actually was performed. Halo can be done. And I want to show you something on skin types where, look at, there's pigmentation through here. She's irritated. Everyone goes, well, you can't do laser on this. That's not true. If you understand what the laser is doing, and you guys look right here, this is the holy grail, PDO Afterglow, my PRP Emmer skin combo, and my products. Okay, you see them there? And look, I want to show you guys. So this is her healing process. Now, why, again, post-treatment swelling, especially with Halo being typically much more, but she took PDO home and did it for 3 days in a row, okay, every 4 hours. And look at her skin over a week. Look at that. I mean, life-changing results here to the point where this patient, and just to show you guys the live, I don't want you to think that I'm lying. So here's me talking about PDO.
Comprised of hyaluronic acid with smooth threads. These smooth threads will penetrate into all the little holes on here, giving her an improved look, not only more of a glow, but also tighter skin. Because all those threads are going to go in and produce collagen. It's going to help her skin remodel. It's going to make her skin look even better and prevent that hyperpigmentation. So I'm going to get that on the skin immediately.
So here she is immediately after, and I want to show you guys. You saw her a little bit before. I'm going to go back really. Oh, I can't go back really quick. But she was way more swollen when we didn't put the PDO on. So she did well, and then I'm going to show you guys here the healing. But look at a couple months later?
Back in summer in
Beautiful.
July 2023, I did my first halo laser, and I did come here for the acne, post-acne scar treatment. I had phenomenal results from what you can see from the last time to now. It feels like I'm a new person altogether, and the level of confidence that I have now from 3 or 4 months ago, it's very different. And I don't use any makeup every day anymore, and this is my skin just with Dr. Emmer products.
And that's the thing. The PDO takes time for you to see. So
Yep.
she healed more quickly with less inflammation, but you look at the radiance of her skin, the superficial skincare plus the long-term collagen benefit. Here she is thanking me.
Emmer, that is the goal.
Actually, to a point where I actually cried on live. This is us doing the live. What?
Isn't that the goal?
Oh
For
my
the ones of us that really know and understand lasers and how they work, it's really getting them cooled down quickly after the treatment.
And that's the problem. Newer, I hate to say this, but if you haven't done, and I don't mean this in a negative way to any nurses, NPs, or anyone that's on, even doctors that haven't done fellowships with laser training, they're trained by a company to do a treatment with a card that tells them protocols, but that's not real life. Real life is not a protocol. And following a regimen that a company has told you or a skincare company gives you is not customized. And it does not allow for most people, about 90% of people, to actually get a great outcome. And then what happens is those 90% seek providers like me. And that's the whole reason I'm doing this. My goal is to train people. And that's why actually we'll be launching in the first of the month. You guys will see my Emmer University, which is going to be a lot more training for people, because I'm just getting very disappointed in the number of burns, the number of poor treatment outcomes with lack of education, because people are just selling lasers. And that from the past, it's probably even worse now.
Well, and that's what I'm getting at. It's like that bulk heat that just people don't understand. And that's why I produced this. It's like we find that the HAPO combo just cools them. They'll actually say, I feel cool already.
Here's the proof. And here's the proof. And I want to tell you something. My intense hydration mask, which has in it tea tree, licorice root, botanical complex, peptides, hyaluronic, and peppermint. When you combine it with the PDO Afterglow, it's like night and day. I could take somebody the next day and all their swelling's gone. And it's incredible. That's what I mean. I can't produce. I don't want to produce what you have. I want the collaboration so people understand that sometimes we need the best of the best. And the best of the best in the skincare is me. The best of the best in the topical post-treatment products and long-term anti-aging is you. And that's where it's the benefits of this. Look at this. This is life-changing.
It is. And that's, my passion is great skin. Obviously, I think you felt that when we talked, and my passion is lasers. Lasers, great skin. What's the use of doing? We go back to the healthier the skin is, the better end result you get in the facelift. All this
and surgery. I know, and that's the thing. There's studies that show now that the facelifts that have the least complications and the best results are the ones where people have been doing maintenance treatments for years. Microneedling RF technologies, lasers. And so anyone that says any different does not know the studies, right? And we know collagen's produced with retinol and topical products. So now to have something that makes it in hyperdrive and is literally like an enhanced thing is just out of this world, which is why I'm doing this. I mean, look at these outcomes. This person's a different person. You know what I call this? I call this the car wash effect. You could take any car and get it cleaned and it looks great. Doesn't matter if it's a Ferrari or a Honda. But if those cars are dirty, they look significantly worse. So when somebody has the clear, radiant, smoother skin, it doesn't matter if they have laxity. It doesn't matter if they have wrinkles.
100%.
They look younger.
They look younger. Because you can lift, we go back to, if you lift dirty skin, it still looks dirty. They don't look younger. They look much younger with better skin and loose skin.
Yep, and here's a great example of somebody that had what doctors were saying were scarred areas. with deep pigmentation with improvement. Now, I could have done oral tranexamic acid. I could have done a million things, but it's not necessary. It's starting the proper skincare and lasers and understanding how to do this in an Indian skin type, which I gladly will teach people if they join my protocols when we start launching it. But here's the example of immediately after. And then now look, I want you guys to see day one. I don't know what providers on here do lasers, but day one with what I did should be very swollen, especially if you're going 450, 500 in depth on the 1470, they should be like a balloon. But because we're doing that daily routine, including my mask, it really helps significantly reduce the swelling. And I'm just telling you something, it's gonna protect you against hyperpigmentation. And it's gonna protect you against people getting worsening results. And here's her sending selfies. Obviously, if she's taking selfies, she's happy as hell. That's what I want. I said, send as many as you can. That's what I love. Same thing here. Now, this is a little bit more different. She's lighter skin tone. The whole point of this, again, with the same treatment protocol, except for microneedling RF being added, the difference here is a light skin tone. So why do I bring this up?
Really well. I saw.
I'm going to show you in a second. So why do I bring this up? Because in this patient, we're going much stronger, okay? Much deeper, much more. I mean, I would even have done CO2 on her. She didn't want to do it. And that's why you see redness, okay? Even at day one, she's pretty red because we did more. But look at the swelling, significantly minimal, very minimal compared to the strength. She should be red for 3 weeks based on what I did. But I want you guys to see, look at this. A week to 10 days later, this is day 5 with light shining directly in front of her, meaning that we're not blanching it out. It's amazing. Like even improvement in the scars, you would think she would have a lot of that prolonged erythema. I'm gonna skip through, but there's some, you see a little bit.
But not what it should be.
Oh no, not what from the past.
Yeah.
Had she done a real protocol, which would have been doing some filler and also doing a stronger laser, center part of her cheek would be definitely a little more red, but not that much. And this underlying redness is that collagen producing that we want long-term, and those threads are in there to help her with that. And that's also why I think there's more improvement in the scarring itself, because you got the threads in there. Now I could have inserted some smooth threads. I could have done filler. I could have done subcision. I could have done an ablative laser. I leave it to my patients to make the decision, but she did all the skincare. So this is a good example of treatment with laser followed by a protocol that enhances the outcomes. Now, what I would do if she was willing to do it and have the funds, a week later, I would have her come back and I would microneedle or roll in or do glow pin of the PDO. And it would speed up the healing. I might do some glacial, I might do, and then a month later, another lighter laser like a Fraxel as a stimulatory or a Moxie, and 2 months later, I would repeat. But I would keep that process going. It's like a personal trainer. You keep working out. You got to get that skin. Now look at it. It's like porcelain skin. Look at her before. Look at her redness. And now it's improved. Everyone goes, lasers give redness. What are you talking about? Look at this. Lasers improve redness. And this is without a vascular laser. So whatever these companies teach you, they're not teaching you the proper process. They're teaching you based on a book. They're not teaching you in real life. So
well, unfortunately, they're teaching based on what the FDA has cleared them for. Let's face reality.
It's safe for the majority of people with less experience.
Exactly.
And that's why I'm doing this, because I want people to see if they want further education and they're looking to do this, they can. This is an example. Another patient, sensitive skin type, some redness, scars, and now we're doing the filler. Now we're doing the CO2. But we got the afterglow in there. We pre-treated. So again, just so you guys see, I'm not lying. Look here. Look on the chair. This is why I was like, Jordan, you need to get the live, so I need them to see that I'm not making this shit up. Excuse me. It's on the. Wait, where is it? Where is it? Oh my God. Hold on. Let me just finish the laser. So we're lasering here, and then on the tray, I saw it. The PDO is there.
Yep.
There it is. There it is. So we're applying it. Okay, you guys, this is the key. Now, the cool thing about it is the thickness of it is good viscosity, so that you can actually get like a layer on the skin, and it allows it to really push in when you're doing my mask. That's why I like it a lot. So the mask really penetrates it, and the cooling effect that you described, it's enhanced. So we do the mask with the PDO, and they hold air for 5 to 10 minutes. Red light, apply my illuminating mask. And you could see from just, one session, it needs more, but these are deep, okay? These are very deep. This type of scarring is extremely difficult. It doesn't look like it's a lot, but these are really kind of punched out. I call these atrophic scars. There's no actual name for this type of scarring, but you could see the area I did the CO2, and it's really not that inflamed compared to what it really should be. And if we did enough subsequent treatments, I mean, look at the depth of these. So difficult to treat with one treatment. That's a lot. That's like 50% improvement. And without all the redness and pigmentation, because
I was going to say somebody of this skin color should be much redder.
I mean, lasers. I mean, look, this is not minimal. This is 50 to 70% fractional. So that's a lot for a darker skin tone, So someone like her, the reason I bring this up is now we have the darker skin tone. Now let's get the lighter skin tone, much stronger. Okay, again, should be red for months and months. I even did punch excisions because some of these are so deep that you need to cut them out. Otherwise, it just doesn't improve. So I'll show you really quickly. This is the actual video of us doing the treatment. I'll show you so you guys can see the full process.
Acne scar treatment, laser removal, I think it's called. And I
love how my patients trust me.
I don't know that I started breaking out more and it's scarred, so I want to get that situation fixed. I found Dr. Emmer through my dermatologist, who is through the SINY network, and he just highly recommended him. He said he was the best, so I just went with his first choice.
You can see we decided surgically to remove a few scars. We actually went through these scars together to determine which ones she wanted removed. These were some larger ones that she has. The good thing is by removing these, we're going to be able to laser on top and around.
So step 1 is to cut them out. Step 2, we start our microneedling RF, much more aggressive around her mouth, multiple passes. That's where she had all the scars. Step 3 is halo. So you guys see, I'm doing a pretty aggressive halo. Okay, this is not, again, like I said, these people could be very swollen. And then I'm doing now, if you take a look at the channeling there, it's about 80% density, and I do a couple passes. So it's very aggressive, what we did here. And then we apply the PDO, PRP, we do my product with mask again, and then I just want you guys to see immediately afterwards, it looks benign. It looks just a little swollen, but now look.
Yesterday was like very hot, very cold, but I washed my face last night and did the steps, and the same thing this morning.
And what she's talking about there is applying more of the PRP and the PDO Afterglow and doing my mask. I have people do it every 4 hours, as long as they can afford it, for the first 3 days. Afterwards, you guys could see how aggressive we did around the mouth with her resurfacing, much more than the Indian patient I showed you before. And take a look.
Beautiful.
Again, the redness, I think this is about 2 weeks. The redness should be significantly worse. And you see it's a little bit more around the mouth, but not bad. And what I would do again, I'd have her come back right now, do glow pin with PDO, and I would just apply my mask again. And I would keep doing that every couple weeks until we get to the next laser treatment if she wants. I think she's doing, sorry, you guys.
Dr. Emmer, but why don't we talk about the fact that somebody that deep a few years ago would have been red for 6 months?
What?
I said somebody done that deeply years ago would have been red and swollen for up to 6 months.
You'd have to wait forever. Yeah, you'd have to wait like 3 to 6 months minimum. Now, with all these products that we have, I mean, if you have people coming in regularly doing facials with PDO and just healing, they can do treatments more frequently and get results faster, which is what we do. And then, so here's an example I love, again, showing the real life.
Hey guys, we're on treatment 3 with one of my beautiful patients here in New York who had some really severe scarring. I want to show you hormonal outbreaks caused a lot of these differences in scar textures. Let me show you ice pick scars over here, some very deep atrophic scars over here, and some cystic indentations over here. This required us not only to do fillers, punch excisions, and laser combinations, but I want to show you because with the right aftercare, pre and post care, and also following some aggressive laser treatments, she looks so good. It's almost like you don't even see the scarring. You can see very minimal scarring in those areas.
Look at that.
Here, and we went much stronger. I'm gonna mark those areas.
And here's the thing, I love her, but she didn't follow my protocols. So if she was doing more regularly microneedling with PDO, like monthly, and facials, and doing a Fraxel every couple months in between, she would wait like 3 to 6 months for another treatment. The results would be even better. So again, but look at the depth and look at the healing. I mean, it's dramatic. I mean, it's remarkable, to be honest. And this stuff can't be made up, especially these types of scars.